All right, everyone, welcome back to another episode of the More Sibyl Podcast. Just FYI, this is recorded live in Lagos, and there's so many natural noise in the background you're going to be hearing. So, for example, dogs will be barking, doors will be opening. So just a heads up. But those are natural sounds, and you haven't heard that on the podcast in a while, so that should be a welcome revisitation. Today, we have the pleasure of bringing an extraordinary individual to the podcast. She is the first child in a family of 7. She hails from the Igbo tribe in Nigeria, but currently resides in the United Kingdom. She holds a bachelor's degree in nursing, and she's licensed to practice in Nigeria, New Zealand, Australia, and the UK. She lives to inspire women to be in control of their lives, spiritually, and also overall health. She was diagnosed with breast cancer, and she found a way to empower and connect other people by sharing her story with the world. She also loves to travel. She also loves to help others. And I should also add that hosting such remarkable personality on the show that represents, resilience and empower people has always been a privilege. And today for me, I think is an extra privilege because she's still currently in treatment. And being able to take our time and talk to us, I mean, come on, guys. So what a very rare opportunity. She's such a person who wants to really, amidst all the things she's going on, to bring inspiration to multiple women across the globe. So we're looking to share her story today, to just explore some of the lessons we can learn and hopefully infuse hope to others who have been diagnosed with cancer, who are yet to be diagnosed with cancer. So everyone, please join us in welcoming Miss Vivian Nwogu to the podcast. Hello, ma.
Hi, thank you so much, Mo. Good morning, everyone.
Thank you. I should also mention that I saw Vivian's one of her videos on one of the Nigerian blog posts on Instagram, and the setting was, she said, "I'm a nurse with breast cancer," showing you how she's taking treatment and then working, and I'm like, wow. I mean, this lady is young and full of life and still, I mean, you can just see that there's a lot of strength there, right? And so I wanted to bring down a podcast. I should also even tell you guys that she's been super responsive. She's the dream of most podcasters, by the way. But please don't stress out though, because she needs a lot of rest. But she's been very responsive with emails and so eager to also share her story. So let's get started real quick. Can you tell us a little bit about your upbringing, and what do you think? How do you think that has shaped your outlook on life and responsibility?
Okay, thank you so much for the opportunity to be on your podcast, first of all. I'm excited. About my upbringing. So I was brought up in Owerri, Imo State, in Nigeria, but I was born in Mbise, which is my village. So at the age of 5, I was taken away by my aunt to be trained by her and her husband, because my parents couldn't afford to train me at that time. So I'm the first child in my family, and being taken away from my family, I felt like at age 5, I had to go back again to being the last child, because amongst my cousins, I was almost around the last children. My upbringing was actually, I feel like growing up with my cousins made life easier and better for me and set me up for a brighter future than I would have had if I had been raised in my village. Yes, being that I had to mix with other children that were not being raised in the village, and then I had the opportunity to also have a quality education. Growing up too, I had the opportunity to represent Imo State in some competitions in primary school. Then I went to Federal Government Girls College, Umuahia, from JSS 1 to JSS 3. And in my SS1, I had to return to Owerri Girls Secondary School because I developed ulcer. So, but generally, my upbringing was, I would say, God intervening in my life to set me off for a better journey in life. And it shaped my outlook in a way that I feel like most of my mates that didn't have the opportunity I had have a very different life path and trajectory compared to what I have currently. And that has also shown me that no matter where you're coming from, all you have to do is be able to kind of stay in the path that will benefit you more. Because as I grow, I keep looking back at where I'm coming from, where my parents are, and what life could have been if I was with them. So it helps me stay on the course that God has provided for me to have a better life.
Wow, thanks for painting that. And I think your story that's quite, common in Nigeria, where, children are sent to live with other family members who can help support them. But I'm glad that in your case it turned out to be in your favor, because I've heard a lot of horrible stories of abuse, of just, exploitation. So let's thank God that he used all of that. And as you're even talking, I was thinking of the story of Daniel, in the Bible, of how, all the tribulations he went through and how God used all of that for, at the end of the day, for good. So I'm glad to hear that everything worked out for you. And I went to FGGC Oyo, so Pro Unitate.
Wow.
Yay. So let's talk about your path towards nursing, right? And so you trained in Nigeria, and then you found your way in the UK. So 2 questions before it's over. What inspired you to study nursing, and then how did you find yourself in the UK? And not only that, you also licensed to practice, in Nigeria, UK, and also was it Australia as well?
And New Zealand, yes.
Oh wow, look at that, smarty pants. All right, so tell us your path towards nursing and how you found yourself in the UK.
Okay, so to be sincere, growing up, it's like a family thing that Akudo, that's my middle name, Vivian, has to study nursing. But I never accepted it because I'm more artistic. So I wanted to be either I wanted to study mass communication or be an actress, right? So I refused to go for science classes until 2008, thereabouts. My dad had an accident. So, and by then I had been taken back to my parents because my aunt stopped training me when I finished secondary school. So I had been taken back to my parents. My dad had an accident that night, and he had to be taken to a local hospital where he stayed for like 1 week. Now, while he was in the hospital, the doctor was encouraging us to give him malt, mix tomato paste and milk, and give him, because all these things were supposed to give him blood, right? So while he stayed there for that 1 week, we didn't know that as we were giving him with this malt, milk, and all these things, he had developed diabetes.
Oh wow! Yeah.
So his wound was not healing. So when we after 1 week, a family friend of ours, who was also a medical doctor but was in the government then, I think he was the provost in House of Assembly, he suggested that we transfer my dad to FMC Owerri. So my dad was taken to Federal Medical Center, yes, Owerri, and the doctors and nurses rejected him. They said his wound had decayed and it was smelling and they cannot have him in the ward. So the way they pushed my dad out, and me and my siblings were with him, and my dad started crying and we all started crying. So I don't forget that day. It was very traumatic for me and my siblings. And the only way my dad was accepted again was when the House of Assembly member, who I told you is the doctor, actually came to the hospital, and they now saw that this person is a prominent person, and they all started running around and accepted him into the ward.
Wow, can you imagine that?
So that made me, I said, I'm going to have to become a nurse, because it has now come to the point where if you don't know what is going on in healthcare, you probably
family will suffer.
Exactly, family will suffer. So that was what pushed me. That same day, I decided I'm going to switch to nursing, because all this while everyone has been saying study nursing, I refused. So I didn't do science
courses. Yeah,
exactly.
So you had to start from the beginning.
Exactly. So I had to go back. I had to go back, attend classes, took WAEC again. And the funny thing is, so that was actually what inspired me to get into nursing. But the journey of becoming a nurse was not also easy, because after I passed my WAEC, and I started looking for school. I didn't have a proper guidance about what schools to look at, where to go. So all I knew was write JAMB and look for schools of nursing, right? So I took JAMB and then started hunting for schools of nursing. Now in Imo State, at that time, it's very difficult to get nursing admission. Unless, of course, you know somebody that knows somebody. It's crazy. It was crazy at that time. So I couldn't get in via university. Now I got into a school of nursing. Little did I know that the school of nursing was not accredited. I didn't even know schools of nursing were supposed to be
accredited. Hey, God.
Yeah. So I got into Abia State, one school in Abia State. By the time I could do my registration, I was told I should better run, that most students that were there for years have not graduated because the school is
waiting for accreditation.
Absolutely. So that was when I knew about accreditation, and I stopped that one. I got into another one. Now remember, my auntie had already taken me back to my parents. So at this time I was operating. By the time I was looking for this admission, I had left my parents' house to a cousin of mine who was also a student. But because I couldn't cope in the village, I didn't grow up in the village, so it wasn't easy for me to stay.
Yeah.
So I had gone back to Owerri, started a job in a computer school. So that was where I was getting money majorly to fund all this admission thing I was looking for. Because at that time, I didn't have a strong connection with my uncles to ask them for money. So I was chasing to get the admission, then I can ask for school fees. So I had to cancel the admission in Abia State. I found another school of nursing in Imo State. Paid school fees, started, then told my uncles that I had started. So they helped me complete my school fees. I got into school. Now, by the time I was getting into this man told us that the school was in two sessions, in two segments. The senior were in another location. Then, the pre-student.
Yeah.
So we believed him. We got into school, started. By the time we were approaching the 4th month, one of us traveled to Lagos, because by then stories about accreditation had started spreading. So she traveled to Lagos. I don't know how she was able to do it, and found out that the school we were in was not accredited either. So by this time we had spent school fees, we had spent time. So some people wanted to stay and wait for accreditation. I took my bags and left. And it's a long story. At the end of the day, anyways, at some point I almost gave up on nursing. So one time I was just with my friends. My sister told me I should go and buy another form in a different school where, fortunately, we had a reverend sister as a family friend there. So he kind of gave my sister the information about the school. I should go and buy form there. So I sent my sister money to help me go to buy the form. So she bought the form, and that was how I got admission into School of Nursing.
Wow. Finally.
Actually. Wow. Yes.
Wow. You're so persistent, by the way. I should just say that. You're so persistent, because even as I even telling the story, I'm already I was just thinking about the past Vivian, wow, just how walking up and down and disappointment, finding that school was not accredited, and you still stuck to it, right?
Yeah.
Man, kudos to you.
I think is nature for me. If I set my mind on something, I must get it.
it's a very good characteristic trait. Not everybody has it, by the way, and I hope you know that. So you finish your nursing. What inspired you to leave the country and pursue better opportunities? I imagine that's your main reason outside of the country.
Okay, so when I finished nursing, because of that experience my dad had, I wanted to change something in nursing. So I set up a network called Nurse Hub Africa, through which the intention was to help nurses, both Nigeria and abroad, figure out ways that they can be better and make the healthcare system better in our own way as nurses. But as I kept pushing with this NGO, I realized that Nigeria is not a place for me to stay and do this, because I'll be fighting from a place of being handicapped, especially financially. So in 2019, I had brought in an international company. They kind of came into Nigeria through my NGO. It's a mobile. It's like Uber nursing.
Oh,
It's like
yeah,
Uber,
yeah.
but you can
Like
order
Nurses Without
certain.
Border. Oh, you can order them. They'll come to you, like mobile nursing, like going around.
Yes,
Yeah, telling. Oh,
absolutely.
yeah, mobile nursing. Oh, that's nice.
Yeah. So they were it's an Egyptian company that came into Nigeria, and their vision was this. So I took part in the business, but then we were also struggling because, first of all, nurses were leaving the country in mass.
It's
And
still happening, by the
secondly,
way. The brain drain. Yeah.
secondly, the insecurity in Nigeria was not helping. So it's like everything was just going
And what
left.
year was this, by the way?
This was 2019.
It's funny how what you're talking about right now is still relevant to today, 5 years later.
It's 2019. So I decided that I was going to leave the country because there's no need staying and then fighting unnecessary with empty hands. So 2020, I left Nigeria to Northern Cyprus because I had issues in my relationship I needed to get away from. And then I also wanted to do my master's. So I got admission to do women's health nursing, master's in women's health nursing. So after 2 years, I did my master's and then relocated to UK. I relocated to UK not because I wanted to leave Nigeria. I relocated to UK because I needed the financial strength to do whatever I want to do in nursing. Yeah. So while I was here, I got in here 2022, and then 2023 I got diagnosed
with what cancer?
With breast cancer. Yes.
Okay. Before we talk about the cancer, because that's where we're going to spend the bulk of our time, and talk about some of the support mechanisms as well. So you've been in the UK now for 2 years. And so for someone because you were born in your village, you moved to the city, you had to go back briefly because of school stuff. So you kind of used to moving around. You've been transitionary, right? But I imagine that, and then you went to Cyprus, and then to the UK. What would you say was the biggest adjustment challenge you had? And I'm asking this for people who might be in your shoes. And that said to be, what are some of the protective mechanisms that helped you or have helped you, soften the cushions from those challenges?
Okay, so because I've not been steady, I think subconsciously I picked up a skill, which is how to get integrated into communities or societies, new ones. So the moment I got into North Cyprus, and I didn't know anybody, it's like they don't speak English. Africans are always on their own, but I really needed to get integrated into what was going on. My first strategy was to join a church. So I found that either joining a church, a club, a community, whatever it is, but for the fact it is a place that you can network, is something that will help you get integrated in the society. Now, in my own case, in North Cyprus, something that was very prominent among Africans was church. So I joined a church, started serving in church, and that helped me get to communicate, get to connect with a lot of people in a very short time compared to the people that I came in with that had to stay like 1 year, 2 years before they were able to meet anybody and make friends, especially 2020 when there was lockdown. So that is one thing I've also seen. I've also done the moment I also got into UK, apart from where I worked, I tried to participate in events and attend events just so that I can get to meet people, and get stabilized in my new location. That's one thing that has helped me.
This is okay. And I did that exactly as well. So for anyone listening, it's good to mix with your people, wherever it might be. But if you want to thrive in a new land, make sure you're getting diversity of supports, right? Like I live in Oklahoma. We have a Nigerian community there, which I'm very much involved in. But I don't want to hang out with them all the time, And I'm sure they don't want to hang out with me all the time, which is good. But mixing with different people with different opinions and with different experiences, that's how you build support. And I really appreciate you for mentioning that. So now let's talk about. Oh, sorry. Go ahead. No, go ahead.
One thing I also did was I joined Rotary Club. I came to realize that just being in your church or your classmates, then it's not that much. If you join clubs like a Rotary Club, there you meet professionals that are way ahead of you from different countries, different backgrounds. So things that you'd normally not have access to, information you'd normally not have access to, you have access to them through such places. But going to places like nightclub, hoping to meet tangible people, it happens, but it's not
the quality again. Think about
Absolutely.
the nightclub. The purpose is supposed to be for fleeting purposes, right?
Exactly.
So you get to meet people, but is it the kind of people you want to meet? Maybe not, right? And as we're even talking about Rotary Club, I did Toastmasters. I have a pickleball community. So I think find out what your interest is or something you want to get better at. For me, it was public speaking. That's why I joined Toastmasters. I met a lot of people that were local to me, senior, like older people as well, that were able to even provide like that grandma, grandpa, support that you need,
Exactly.
So again, find your interests or something you want to get better at, and then find the community and then engage in that. Thank you so much for mentioning that. So let's talk about the cancer diagnosis. So let's talk about the very first time you, like, again, from my experience working with so I've been doing cancer research now for the past 13 years, and my father figure passed away from prostate cancer. He died here in Nigeria.
Wow.
And he had money, so it wasn't a matter of him not having access to healthcare. He had houses, he traveled a lot. He was a well-traveled, well-to-do man. And so by the time the cancer was diagnosed, it was obviously at the late stage. And I saw him go from who he was to like half of his body size. If I went to his house, I passed by him, I didn't even recognize him. He looked older and shriveled. And that picture is still seared permanently in my brain. It's a picture I filter all of my experiences and engagements with my patients, because I'm big on prevention and early detection, because at the rate at which we're all living now, for most people, it's not a matter of if, it's a matter of when they'll be diagnosed with cancer. But it's not always, it doesn't have to be like like a death sentence, right? If we do the right things and, get it diagnosed in time. But I'm always very curious to know about looking back in time. What were some of the signs and symptoms you had, and how did your diagnosis come about?
To be sincere, looking back from this point, the only time I feel would have been a sign that I didn't pick up was when I had galactorrhea. That was when I was way younger.
So that's milk coming out of your boobs.
Absolutely. Yeah. So I don't have a child. I've never given birth. I've never been pregnant. But there was a time around 2013, 2012, I noticed that I was having milk coming out of my right breast.
Wow.
Right? Yeah. So I went to the doctor, and I was told that it can be hormonal imbalance, and sometimes it resolves on its own. I shouldn't wear tight clothing, and I shouldn't touch it too much. I should just allow it. So I followed all these things, and it stopped on its own. So that's the only time I can say that maybe that was my body giving me a sign.
Yeah. But why would you have known? You went to the doctor. You did everything right.
Absolutely. So, and then I'm not someone that I don't drink. I drink occasionally, just once in a blue moon. I don't smoke. I feed more on vegetables, because that was what I was fed while growing up. So I'm used to that. I don't like the taste of sugar. So I'm someone that, and I take my vitamins a lot. I love to take my vitamins when it comes to me. From my own perspective, I've always done the right things when it comes to health. So when I got diagnosed, there was no significant sign, right? The only thing was that someone called a friend of mine on phone and said she had been diagnosed with breast cancer stage 4 and that she was in the hospital. So we had a conversation about it, and the thing kind of I was surprised, and anxious at the same time, because I mean, she's very young. She's like 31 years old, and she's been diagnosed with breast cancer in the UK. I was scared because I'm around the same age. So after the conversation I had with my friend, I checked myself that day, checked myself the next day. Let's say on the 4th day of checking myself, I noticed a lump. So sometimes I even wonder, how did it come? Because I know I checked the 1st, 2nd, and 3rd day after those calls. But on the 26th of December, I noticed a lump in my breast. I panicked. I called my GP and I was called in. And even my GP checked me and said, yes, there's a lump, but that I have dense, what did you call it?
Dense breast tissue. Yeah.
Exactly.
I think most Nigerians have that too. You know,
Absolutely.
you have to use the ultra, like the scan has to be the one that is mammogram to like see magnifications and all that. Yeah.
Absolutely. So my GP checked and said that he doesn't think it's something to worry about because of the kind of breast I have, but that he will still refer me. So he referred me to my doctor in my hospital. I went to the breast surgeon. She checked me and said the same thing, that first of all, I'm too young. Secondly, I have breast tissue that is nothing to worry about, but they will just do biopsy. So that was how they did biopsy and found out that it was breast cancer.
Wow.
Stage 3.
Wow.
Absolutely.
And before then, you had no symptoms, like
no
apart
signs.
apart from the galactorrhea I talked about when you were 13.
Yeah.
Let me just pause here and say that this is a very key moment in our conversation for everyone listening. Is oftentimes cancer symptoms are very, very benign. You don't even feel anything. Yeah. So like prostate cancer now, most men don't even see what's going on. Maybe they might have some issues with peeing, their stream, or sleep might be disturbed, or they're having back pain, or they don't have strong erections. So all that to say that don't wait until something is going on visibly with you before you start seeing the doctor. Usually can be a sign. When you start having those symptoms, usually it's a sign that it has progressed. So early detection is key. And what does that mean? Once a year, at least once a year, get all of your everything checked. As appropriate as possible. If you have a family history of a particular disease, talk to your doctor about the age appropriate time to begin having those screenings. Get your blood checks done. Eye, teeth, everything from head to toe. Once a year, just tick it off your list. You know you've done good for that year. And then repeat again the next year, because you need to have baseline numbers to like track you with time. So stage 3, what went through your mind when you heard that, Vivian?
First time when I was told,
yes,
the only thing that came to my mind was my siblings.
Because you are the first of 7. And the old, yes,
I'm the eldest. And that also taught me what people feel, those that have children, how they feel about their children. Because at this point, I now see my siblings as my children.
What's going to happen to them?
Exactly. Who will speak for them? Those of them that are still in school that I have to train or help.
Yeah.
How are they going to? That was the main thing that was bothering me. It wasn't even about me at that point.
Wow.
So that was really my fear. But then the consolation that it's not yet at stage 4, that means something can still be done at this stage, kind of calmed me a little bit. But I wasn't concerned about me. It was more about how will my siblings cope without me. Because I thought I was going to die. You know, when we hear cancer, it's almost
death sentence. Yeah. And for a lot of our non-African Black populations, you're wondering, why is this person thinking about her siblings when she's the one with diagnosed? Well, we feel responsible for us. I don't know how to explain it. It's not something we have to do. As a firstborn, you just, I don't know, automatically wired to carry the burden of the family, right? So it might be weird for anyone thinking, how come she's thinking about her siblings instead of herself? But just like that. And I imagine for Vivian, if I can just make a guess and let me know if I'm wrong, as someone who's been helped a lot, she sees as a privilege to be able to help her family. I bet you that most of the things she's doing right now at the moment, which you can talk about the good and the bad side of it, is you just want to help your family as well, liberate them and give them good education so that they can also be lifted out of poverty. Would that be a right assessment to make?
Well, you are extremely right. And, this is not good though. It's not.
There's a downside to it. Yeah,
absolutely. It's not because I didn't pay attention to it until during this my treatment period. They had to sign me up for therapy and counseling. So on one of those sessions, I mean, let's say on the third one, the counselor asked me that I sound like I am hyper focused on my family.
Siblings,
That yes, I hardly ever talk about myself. Don't I feel like being taken care of at some point? I told her, I know that I feel that way, but sometimes I don't even know that I need it. Right. So having that time also helped me to see how much I've ignored myself and how much of other people I've been carrying instead of myself. Even talking about it now is bringing me to tears, because I think being an African child, it's like you are trained from beginning to the end to focus on other people, even when you are dying, which is, don't think it's good, sincerely, but what can we do?
It's not good. It's not good. I mean, it has some good things to it. I think this is where boundaries and I'm glad that your physician picked up on that, right? And I think for you, it's also very layered. You've been helped by people that we've seen societally, they don't really help, in that sense of the word, right? And then I think for the kind of person you are, you're very kind, you're very giving. So that's like a double whammy right there. I think with time I share this stage of your life where you're still trying to build up and even build yourself back to a place of, better health. It's okay to prioritize yourself. And I imagine that your family, if they say that choose one, money or Vivian, they'll choose you. Right? So think of it that way. Like, it's okay to prioritize yourself, because as you can imagine, with cancer treatment, the treatment can be quite, debilitating. Like the side effects, the weakness, and just even the mental overload. So it's okay to put yourself first for now, and then with time, when you're back on your feet, slowly ease into that. But again, always still at the back of your mind, my therapist told me something: the problems will never end.
True.
They will never end. Yeah, and I think as firstborns, I'm a firstborn too. I have two brothers.
Oh, wow.
And I'm responsible for money that people apart from my two brothers. And when I say responsibility, it's not like, but I still, help out and all that.
Yeah.
The problem never ends. There's always something. And we feel like we should take care of it. The problem is coming, we're taking care of it. But the way we act with swiftness is also making the problems appear swiftly.
Swiftly, true.
So I'm learning now to actually let them be innovative in finding solutions to their problems. And money can't be the solution to everything.
True.
Sometimes I had to close my eyes and just look the other way, like, I cannot do this one, sorry. And there will be good reasons to do it. It's like, I'm sorry, I can't do this one this time around. The part of you feels like, this is wickedness.
Without me, exactly.
We need to work on that control. It's control issues. It's our wanting to take charge and be in control, which can be problematic. So again, I think you should keep working with your therapist. I've had to do a lot of work in that area. The problem will never go away. But for you, this is permission. Giving you, as the firstborn to another firstborn, I'm giving you permission to prioritize yourself, please, especially during this tender moment of your life. So you're currently still in treatment. When did you start your first treatment? And are you at liberty to tell us, is it hormonal or what's your... You don't have to mention
it's hormonal.
Okay, hormonal treatment.
Yes,
and how many courses have you taken so far? Like, what's it looking like since you started your treatment?
So I started my treatment around, I think, April, January, February, March. I started my treatment in March. I had a mastectomy of the right breast, and then axillary clearance, where they had to remove the lymph nodes to check how far it had gone. Then in April, I had to be taken back to surgery because they needed to bring out more lymph nodes. So, and then I had egg freezing. Good. So, yes, to preserve my fertility since I don't have it. And then I've just finished with chemotherapy. So I had 8 cycles of chemotherapy scheduled, and at the 6th cycle, my oncologist said it was okay, that I've had enough, because at this point it's now preventive.
Yes.
According to her, the mastectomy and the axillary clearance took out the cancer already. Great. So, but they had to put me on chemotherapy and radiotherapy just to make sure that any other remaining bits of it in my blood will be clear.
Wow. Had it spread? I mean, with stage 3, there's a degree of spread, right? Where had it gotten to?
Yes, it had.
Yeah.
Just my lymph nodes.
Lymph
It
nodes,
hadn't
okay.
gone to any years. Yeah.
Okay. So
I'll be starting radiotherapy in December.
okay.
Yeah.
Okay. Oh yeah, I think you said you were going to be away, so we should record earlier than usual. Yeah.
Yeah.
And here you are talking to us. Wow, Vivian. You know
It's
what?
like
I know, like it's very it's you overcome this. I believe that strongly. But your strength, your resilience is something that I think is made for the books. And I'm glad that you are in the UK where you have access to health, which, my goodness, imagine if you had that in Nigeria.
Oh
I'm
God.
sorry. I'm just sorry.
If you see my DM of women that are going through the same thing, the same exact thing, but in Nigeria. Oh Jesus.
So let's not even talk about that. And I work with a friend. Her name is Tolu Follower. She owns an NGO, Cancer Aware. And she helps with patient navigation, getting access to cheaper clinics, good clinics, because some of these fake doctors, she will hear cases of someone that had a wound on the breast, was cancer, and then they're going to do surgery to scrape the wound out, but then the thing spreads, of course, because if you're not doing it the right way, they'll now bring that's when they'll now, someone that is using herbs and whatnot. So by the time they get to her, it's like, what are we even going to be able to do? But we're seeing a lot of younger women in their 30s with more aggressive forms of cancer in Nigeria. Triple negative cancers. 30s. What is going on, right? So my question for you, and before I even ask that, will be, for those that are even listening, for stage 3 breast cancer with lymph node, it means that the cancer has spread, beyond the tissue itself, and it's, with the lymph nodes. So think of the lymph. How do I even explain the lymph node? So
it's like a filter.
Yeah, exactly. So think of it like little pipes that go around your body, and they are very, very important, because think of pipes of water. Like if one pipe is blocked, you can have issues, right? And it can spread things everywhere. Yeah, think of it that way. Yeah. So what would you say has been the biggest, because with the treatment you've done and the way they had to tackle it because of the stage of, spread and all that, I imagine as you're taking your treatment, you're having side effects and things you have to deal with. And then even as like the a little bit long term of it, what would you say has been the biggest challenge you've had, and how have you been managing it?
My treatment side effects has been, the biggest I had was actually the chemotherapy infusion didn't give me major side effects. Now the struggle was the follow-up injections, because after the infusion, your white blood cells are supposed to be supplemented. So there's this injection I was given to be taking my filgrastim.
Filgrastim, sorry.
Yes, that was my nightmare, because it's like every time it comes with different side effects. And on 2 different occasions, it sent me to the A&E.
Wow.
Yeah, the first one was severe agitation. I couldn't stay at a place. I could not think straight. The doctor didn't even know what to do for me at that point. Not my oncologist, but the doctor I met at the A&E. So I had to come back and took some sedatives to help me get through it. The second time I landed in the A&E because I was throwing up blood at home and in serious pain. And that was the day that UK decided to show me that their ambulance is not prompt. Because I don't know other people's experience, but mine, I was told to wait for extra 3 hours and I was dying. Yes.
Because just taking Uber.
I swear. The person told me that the ambulance was out to go pick somebody else, and it
only one ambulance.
I don't understand. That I have to wait for extra 3 hours.
And you guys have hospitals very close to your homes, like you have regional hospitals.
Yes. And I'm also a staff in that hospital.
Wow. So what did you do? He had to come and get you?
A friend had to come and pick me, yes.
Imagine if you had just waited that 3 hours. I don't think we'll be having this conversation today.
I don't know. I don't think I would have had that 3 hours. I don't think I would have had that 3 hours. I don't think I would have
I'm
had
so
that
sorry
3
about
hours.
that.
Anyways,
Oh.
when I still went to the hospital, from what I was taught in school, right? When a patient is in pain, and then there are other things like an infection and let's say other things, what you're supposed to address first is the pain. What you're supposed to address first is the pain. Then you can continue with other things like running tests to see if there's an infection. But do you know, I got to this hospital and they first of all were focused on checking for infection while I was dying in pain, throwing up blood. I don't understand what happened, but I was really disappointed, especially being a nurse and knowing what was supposed to be done.
The protocol? Yeah.
Exactly. The pain intervention was the last thing they did for me. And I don't think I'll ever forget that day. So that's the highest of it I've had. But the most prolonged side effect that affected my quality of life was pain in my bones. So after I got discharged from the hospital, I think the third session, I had filgrastim. It was no longer coming with any other side effects apart from bone pain.
That's one of the major sides. It's called a mild bone pain, but patients will tell you it's not mild.
This one is not mild though.
Yeah.
Because my bones were feeling like they were going to explode. Right.
So for those I don't know, filgrastim is the branded name is Neupogen, and it's a bone marrow stimulant. So when you have cancers really attack they attack your cells, right? And they're rapidly growing. And what that can also mean is that your white blood cells, which is what fights your infections, the count to be going down because they're overwhelmed with this cancer, So you don't have enough armies. You have more invaders and armies. So coming filgrastim to stimulate more bone marrow production, right? So it also helps to improve survival in people who have been exposed to radiation therapy through cancers. But really, after you've received your cancer medication, to help stimulate white blood cells so that you can have more fighter cells in your body. But because of the mechanism of action, one of the side effects is bone pain, which can be quite the effect on patients can be quite really bad. I think a patient that had sickle cell said is worse than the crisis she's had before.
Exactly. I don't know about it, but I heard that the way it happens is the same as sickle cell crisis.
Yeah, a sickle cell, she said that her sickle cell crisis doesn't even compare to the pain she felt with yeah. All right, thanks for sharing that. So with the things you've gone through, right? And giving I'm glad they're able to preserve your eggs. Great, good job. I'm glad that your doctors had that conversation with you. But how are you feeling, especially with, how, I'm just going to ask as a Nigerian and help me. And if you're not able to, if you don't want to answer it, that's okay. Again, this is not live, so we can always take stuff out.
Yes.
With, being a woman, I imagine that maybe along the line, you might want to start a family. Perhaps that's a goal for you, or even, whatever that might come about with you. What are some of the thoughts, going through your head, with, having to, your breast, one of your breasts, having to take that out and then preserving your eggs and those running thoughts, and how have you been able to just control them if that's applicable to you?
Okay. First of all, let me point out that I had implants. Okay. So as my doctor gave me the option of having an implant or going flat, and I was really concerned about how I would feel looking at myself in the mirror, so I had to opt for the implant. So generally, I will not lie to you, even with the implant, I still feel insecure. Most times I have to talk to myself to say it's not that bad, right? But because in my case, there is no natural can never look like artificial, right? It's always this. It's very obvious there that this is an implant. Then secondly, having to preserve my eggs too. Also, I have some kind of anxiety when I think about it too, because you don't know who you're going to get married to tomorrow and their own understanding. There's a difference between when somebody tells you, don't worry, it doesn't matter. And then 2-3 years later, it now matters. Right. And then when you're going into a family too, it's not just one person, it's the entire family, and they might have their own opinion about what has happened. And this is part of the reason I put it out there on social media, so that you will not say that you don't know what is going on with my life. So if anybody is stepping into my life,
they know.
You come in knowing exactly, and don't expect me to explain things to you. So it hasn't been 100% confidence. I might appear like it's not bothering me or anything, but sometimes it bothers me too, because I'm concerned about the person. If I'm going to get into marriage, is the person going to accept me fully? Because we're in a generation now where people go to get into relationships for what they will gain. So if the person deceives you, deceives me, and get into relationship maybe because of what they think they can gain from me, and then by the time they have that thing, they are no longer able to accommodate who I truly am. You understand? So those questions usually come up in my head. So, but how I am able to manage it is, I've seen other women, right? I had this campaign with a couple of other ladies with one brand, and meeting those ladies,
I saw the video, that you took a train and you walked us through it,
Exactly. One of the ladies went flat completely, right? The other one went flat on one side. Now, the lady that went flat completely, she said she met her husband when she was already flat. Right? And that really encouraged me. And the way they carry themselves, that taught me that I still have, that I lost a part of my body does not mean that I've lost who I am truly. Reasonable people will still associate with you, be attracted to you for who you truly are, not because of body parts. So that is what I usually look at when this insecurity creeps in and all that. It doesn't matter what part of my body I've lost. There are people that even lost limbs and hands, and they're still living their best lives. All I have to do is get it out of my head, and then I can handle it. So that's how I've been able to keep a good focus on life. I mean, if the person doesn't like me, they don't like me. It doesn't matter what I have and what I don't have.
Vivian, that was beautifully shared, by the way. And I should just add that whoever is going to find you will find a great thing, okay? And so I'm using this as to sow that, confession into your life. Like, the man God will send to you will find a great thing, and he'll love you for who you are, and you love him for who he is. But I just love how you're able to capture the present moment and the fears and how you're even walking around that. So thank you so much for answering that question.
Thank you.
I also see that you do a lot of advocacy. So you talked about your NGO and even some people that have reached out to you. Given just having to combine, we haven't talked about working and receiving treatment in the same hospital. What has your advocacy looked like? Because you started as just, a nursing advocacy group. I imagine now the scope has increased. You found yourself a ministry for women with, breast cancers. Or what does that look like, and how are you managing that?
Yeah, the funny thing is, I started women's advocacy in 2017. That was my first
before. Wow.
Yes.
This girl is funny, shy.
I have this NGO called Pro Women Safe Sanitary Foundation, and I started it because I remember when I was in Federal Girls, when I was in JS2. So this time, my auntie didn't send money for me to go back to school. She said my parents should, because I was returning to school from my parents' house. So my dad did the best he could. So he just bought me Milo, milk, and biscuits, and packed my things, and we were on our way back to Umuahia. Now, what he didn't know was that I needed pad. He didn't buy me pad. So what I put was tissue, right? So I folded tissue, and when we got to the park, my tissue had already split into two.
Oh, God.
So, and then I was very uncomfortable. I didn't know how to remove it. I didn't know how to tell my dad that my tissue had torn and blood might be coming out. Do you know what I did? This might be very embarrassing.
You put cloth? No, is it cloth?
I wish I had the time to. I stood behind my dad. With my dad was kind of behind the gate and entrance to the park.
Yeah.
So I stood behind him. So nobody was behind me. It was just the wall.
Yeah.
the tissue was already taken out one side. So I just drew it and dropped it.
Oh my goodness. Oh my goodness.
I didn't
That must
know
have been
what
quite
to
an
do.
ordeal. Oh.
I didn't know what to do.
Yeah.
I didn't know how to tell my dad that I was going through that. And, it was very embarrassing. It's still very embarrassing now, but that made me, I said, no. There are so many other girls that might be less privileged and didn't know what to do. So that was how I set up Pro Women Safe Sanitary. And I was with my team, we would go to different schools to give them sanitary pads, give them health education on women's health. On several occasions, I spoke on platforms with French embassy and the German embassy in Nigeria. We held a lot of outreaches. So I've been doing all this. Then I started my NGO in nursing. Then I had to leave everything. Like I told you, being in Nigeria and doing all these things,
it wasn't
just
sustainable.
Kind of So I stopped it for a time, and now I've been diagnosed with breast cancer. So sometimes I think about it, I'm like, as if I knew what was going to happen.
But you wouldn't have known that. I think people like you
Absolutely.
and I, you feel a need because of something, your pain point. This is how the
True.
podcast even started. Like, it's a pain point. You want to help people so you can share stories. Like, that's just who we are. And then you look back, you're like, I'm glad I listened because, this is going to help others. Like, this helped me,
Exactly.
And so thanks for mentioning that. Right? Yeah. Thanks
So
for
that's how advocacy for women started. So it's not something I'm new to. But being diagnosed now makes me kind of understand what people are actually going through. There's a difference between when you're looking from outside and when you're actually in the process. So,
yeah. Wow. So, your work colleagues, I imagine they've been very, very supportive. Why? I'm sure people are wondering, why are you still working? Why are you being treated?
Okay, so I was still working while I was going through some of my treatments, but when it became very severe, I had to stop, right? Okay. And while I was working because I felt, one, I needed to stay away from the house. Mm-hmm. My house was becoming smaller because it was getting to my head. Secondly, helping my patients was kind of helping me heal somehow. Because I work in a gastro department, but most times we have cancer patients, right? So when I help them, when I see what they're going through, it kind of feels like I'm helping myself too. It feels like I kind of see myself in their bed. So when I'm helping them, I feel healed by myself. So I was getting through it. Let's say I was healing my patients and healing myself at the same time. So I was giving myself alone. They were also giving back to me because because I had the opportunity to help my patients. So that was actually why I was continuing to work. Although I was also struggling sometimes when it feels like, because there was this particular incident that happened.
What happened?
I had 2 patients, right? Mm-hmm. One was on syringe drive for diabetes. Then the other one was struggling with respiration. Now, this man needed to be turned every 15 minutes. If not, he would die, right? Wow. So, and then I had support workers. So I had to delegate and move them to help me clean my patient that needed cleaning for the patient on syringe drive, but I was taking care of the medication. But I needed to sit by this patient's side, the one that needed 15 minutes turning. Now, seeing the man struggle, the way he was dealing with what he was dealing with, and then not me feeling if there was something more I could do for him, but I felt powerless. I found myself crying profusely that night, right? And that I think that was part of the reasons I stopped, because after that night, I felt I cannot continue this way. Because now it's no longer empathy. It's now becoming sympathy, which is against what I'm supposed to be doing. I'm supposed to be empathetic, not sympathetic. So that was part of the reasons I stopped. But being able to walk kind of helped me impact to an extent. But when it became too painful for me with the side effects and then emotionally not being able to handle it, I had to stop. So it's not like I've been walking all through. Yeah, at some point I had to stop.
Thank you. Thank you so much. Um, we're rounding off now, but I have some just wrap-up questions to ask you. So one of the biggest things we talk about, like in research, is decision making regarding treatment. And even though you've told us the treatment you ended up with, are you at liberty to share with us, especially for those who might, benefit from it, what formed your decision to go with hormonal therapy versus, and then the mastectomy? And then if you can tell us the order in which that came, what formed your decision to go for that treatment protocol versus, the other ones that are obtainable?
Okay, so first of all, my diagnosis is hormonal, so it's HER2 positive. So, yeah, my own diagnosis was HER2 positive. Yes, yeah. So, which is hormonal. So the treatment was my consultant told me that the way it is not something that you can just remove the cancer cells and you will be fine. Because it is fueled by hormones, there are some hormonal steps I have to take to make sure it doesn't come back, which is first of all removing my breast entirely, not just the lumps. Then I also have to go on hormonal therapy medications. So after radiotherapy, there are some or let's say while I'm still on chemotherapy, there's a medication I started on, which is it's called Zoladex. It's an injection, and this is supposed to
freeze everything.
It's supposed to put my follicles to sleep, so that they don't keep growing and producing hormones that will fuel. Yes. So it was basically the diagnosis that guided the decision for the treatment. Actually, it wasn't a personal decision. And then I forgot to mention the part where when I was where the I stopped being paid.
You stopped being paid?
Yes, yeah. So
please share.
So after I stopped working, after I got in sick, from what I was told, I can go off sick for 6 months and still be paid. So I called in sick. So after like 2 months, I stopped being paid. And when I asked, they said it was the policy. So apparently, if you have been with NHS for just 1 year, you are entitled to just 1 month full pay. If you've been with NHS for 2 years, then you are entitled for 2 months full pay. So I didn't know this, and at some point my salary was stopped. I was shocked when my salary came back and it was not even up to my house rent. I screamed. I scrammed.
Oh my goodness! Oh my goodness!
I don't know which other English to
use.
My
goodness!
Yeah, but my followers came through. Yes, because it's remaining just nothing for me to become homeless. What would I have done?
Imagine?
In Nigeria, you can just pack your things and go.
I'm going to stay with a family member. In fact, yeah.
Yeah, but not that was
Obodo. Who's going to?
Yeah, so but being able to tell my story also gave me that opportunity to have people to talk to when I had that financial issue. And guess what? My followers were able to donate to me, and I was able to pay straight 3 months rent. Something that I know that I wouldn't have been,
Even so when working yourself, it's hard for people to be able to do that, even while working.
Exactly. So, but the reason I brought this up is for people, because I noticed that a lot of us Nigerians don't like to share our stories. But there are so many benefits from it, apart from this financial part of it. If I don't tell you what I'm dealing with, somebody else that has someone that is going through cancer will not know how I'm managing my own. Now, a lot of people that die of cancer in Nigeria, sometimes is sepsis if they had gone through surgery. Sometimes is they are just neutropenic and they don't even know that they're supposed to monitor their blood neutrophils. You understand? So, but if you've heard somebody talk about how they were able to manage with their white blood cells monitoring and what they are doing, then you can say, this person that is going this, are you monitoring this? Are you being dehydrated or not? I remember a patient was once admitted due to dehydration, because she's a cancer patient and was going through menopause. And she said she didn't used to sweat, but now she sweats a lot. So she didn't know she was supposed to be drinking water until she landed in the hospital. Personally, I drink almost 5 bottles of water every night because when I wake up, my bed is soaked. You know, but if I don't share these things, someone else will not know what they are dealing with, and their person will be suffering. So I feel like there is power in sharing stories. I just thought I should mention.
No, I mean, you're doing the work of the host. Thank you for sharing that. You know, we're all about storytelling, setting stories free. Yeah, there's a discomfort that comes from it initially, but I can never have my life any other way. Even the things I'm like, my mother, for example, like, why are you talking about that? You know, put this on the podcast. You know, stop talking about. And I always thought, like, it's liberating because the shame from some of those experiences is not even ours to keep. Right?
Yeah.
But when you share your story, there's even the Bible says is we overcome the devil by the word of the Lamb and then by the blood of the Lamb and the words of our testimony. We should share our stories. Now, you shouldn't share because you want pity or, you know, coins and all that, but to build communities so people we shouldn't do life alone. And I feel like those stories are powerful. So thank you, Vivian, for sounding the alarm on that. Now, as we go, you love to travel, right? You love to do so many things. What does the future look like for you, and how are you looking? What's the exciting thing you're looking for in the future? And so this is also the opportunity for you to almost like leave a voicemail for your future self, because I want you to listen to this in 5 years and be like, wow, I achieved all of that and more. So let's sow that seed, you know, of what your future, paint your future with the words of your mouth.
Okay, so it has always been a dream for me to become an international speaker. So I want to be able to have access to platforms to share my story and also to encourage other women on getting empowered through their own personal life experiences and people around them, and not feel like what they're dealing with is just them, because there are so many other people going through the same thing you're going through and they need that voice. So I want that opportunity to get to that point. Hopefully one day I'll become an international speaker. And
hello, you're on this podcast. It's a global podcast, 2-time winning diaspora podcast of the year. We have listeners across South Korea, Peru. Yes, we're doing great. So this is your first stop, and we're so honored. So honored you're here.
Thank you for the opportunity, really.
As a matter of fact, to our listeners, whenever you listen to this episode, please tag us on Instagram or Facebook and tell us where you're listening from. We're going to share this with Ms. Vivian so she can know that she has, you know, she's making her dream come true. Yes. Show up for her, guys, please. Thank you.
And then secondly, I'd love to have my own beautiful family soon.
Amen.
So that is also something I pray to have. And thirdly, I want to have visited at least 20 different countries before I clock 40. I don't know I know it's something you can achieve in 1 year or 2 years, but in the long term, I would love that before 40. So hopefully, fingers crossed. Those are my dreams. I don't have too much.
So we seal it in the name of Jesus, and you will achieve everything and more in Jesus' name. Amen. For the travel, I'm a travel freak, by the way. Here's a tip: whenever you're ready, I would suggest to go on a cruise. Cruises are great, like, you know, and go on a cruise that has different stops. Last 2 years ago, I went to 8 countries in 2 weeks.
Wow.
Last October, I did 7 countries in 2 weeks. 3 of those countries were from cruises. So we stopped at 3 islands, Caribbean island countries. And then I was going to Germany. I stopped in London for a bit and then went to Germany and then took a train to Belgium for lunch with a friend. And I could tick that off my list. So nice. You're in Europe right now with if you can even travel, you can do all of Europe whenever you're ready, right? That gives you like access to so many options. So it's exciting. You have an exciting future and you should get excited about it. But you're 20 countries in a year. That's nothing, Ms. Vivian. That is nothing. You can do it. You do more than that. I just want to say thank you so much. By the way, on behalf of the podcast, we made an £80 donation to your GoFundMe link. And I will share that link. Of course, I'll share that link with our listeners. I'll put that in the show notes. And I'll also share that with my friends as well. And I'll post it on. As a matter of fact, my assistant is Bibola. Bibola, please let's make a post on Instagram and tag Ms. Vivian about, whenever the episode comes, to tag her GoFundMe link so we can help drive traffic to her page. But we'd love to hear your updates. No stress from us. We'll reach out to you to check in on you and see how you're doing. Don't worry, actually don't reach back to us. We'll reach out to you, okay? And check in on you. You don't have to respond, if you're stressed out and all that, but we'll make sure we're keeping tabs on you and checking in on you. But it's been an honor to chat with you. Actually, it just feels like I'm chatting to another version of myself. Like the drive you have, the heart you have for others. It's a beautiful thing that cancer cannot quench, and we thank God for that. And the world needs more people like you. That even in the midst of it all, you're still very strong. I mean, I watched one of your reels about early detection and why women should take charge and be in control of their lives. Hearing that from a woman like you, who they can relate with, I think that says a lot of story. And now people can even hear about your foundational story. Like you didn't come from a great place of privilege, but you're making that happen for yourself and your siblings. We didn't even talk about your family dynamics and all of that, but we can save that for next time in the future. But we'd like to have you back whenever everything is, all the treatment is done, and we're looking. This will be like a part 2 of the podcast and revisiting things.
I love that.
We have a future there, but in any way we can support you. In addition to what we just outlined, please think of us as a resource. We would love to help you out. Again, we'll put all of your links in the show notes, tag you on the Instagram post and all of that. But in addition, any additional ways you can support you on the podcast, please let us know. We'd love to help you. And thank you so much. Thank you so much for taking our time today to talk to us. It means the world to us.
Thank you for the privilege of being on your podcast. I really appreciate it.
Thank you. And listeners, we hope this was inspirational. If it's something you're looking for, please go get your health checked. Okay? Go get your health check. My friends know that. They don't even like me talk. It's like, this girl has started again. Don't go get your health check. This is your sign if you're looking for one. Yeah. And to our international listeners, you know yourselves, the one from Peru, South Korea, India, we'll see you on our IP. As you listen to this episode, please tag us on Instagram and tell us where you're listening from so we can share that with Miss Vivian so she can know that her voice is actually reaching the world. That will be the greatest gift you can, give us so we can pass it on to Miss Vivian. In any event, this has been the More Sibyl podcast production. We thank you all for tuning in today. Catch you on another episode of the podcast. Take care. Miss Vivian, I hope you have a great day and your next treatment, all the very best, but we'll check in on you, okay?
Thank you so much. Thank you. Take care, love. Bye.